Mr. Chairman and committee members, I'll also be brief. My name is Tim Swearingin. I'm an anesthesiologist. I practice in Springfield, Missouri. Full disclosure, much of this bill does not directly affect me, except for specific sections which remove regulations with regard to controlled substances and nurse anesthetists from the Board of Healing Arts to the Board of Nursing. I assume we'll unpack that more in the next hearing, but I did want to go on record of saying we are opposed to that. I would like to address one of the previous speakers mentioned that APRNs have to specialize before they complete their training. And I don't really understand that because in my institution, I see on a regular basis an APRN working with a group of surgeons, and 6 months later, they're in the cardiology clinic. And 6 months later, they're in the ER or running a Walmart clinic. I cannot do that. I cannot tomorrow decide that I'm a cardiologist. But they can. And they can do that because of collaborative practice agreements and arrangements. There's a physician there overseeing them and making sure that they know what they need to know and that they get educated, a little OJT. There's no guardrails in this law that I can see. So we're talking a lot about, and I understand, rural areas, healthcare deserts, that sort of thing, but there's no guardrails to prevent APRNs from working in any specialty. And, you know, Dr. Haruza made the point, and I'll reiterate, I have yet to see the Board of Nursing see anything that isn't within the scope of APRN practice. And again, they just move freely through the healthcare system, and that's okay because of collaboration. And I'll end, unfortunately, on a sad note. I have here emails to senators and representatives from one of my colleagues in favor of this bill. I have confirmatory emails from .gov to my colleague thanking him for his support of this bill. And I have a letter from him that says, I do not support this bill. I was hacked. This is fraud. This is identity theft. And this is not right. So I hope that as you're perusing all of the emails that you received with regard to this, that you'll vet those appropriately and have discretion, because I since have heard of other examples of this, but it's hearsay. I've heard. This I know firsthand.
I'd like you to give that to our staff here so we can investigate. We got it. Okay. Okay.
And with that, I'll close and answer any questions.
Questions? Any further questions? If not, thank you for your time. We appreciate your testimony.